Morning. Welcome to Windsor-Essex County Health Unit's media briefing for Thursday, January the 13th. This morning we are joined by CEO Nicole Dupuis, acting MOH Dr. Nessa Thury, as well as our epidemiology manager Ramsey D'Souza. We will start with a presentation. Nicole will introduce it, and then we'll move into media questions after.
Good morning, everyone, and thank you for joining us. So we're going to shift to a slightly different topic this morning, although one that's been we've talked about several times in the media, which is opioids, our opioid crisis. And as you all know, we are planning to, as a Windsor-Essex Health Unit, along with our community partners, we are planning to present at the City of Windsor Council on Monday, January 17th, as it relates to approval for consumption and treatment services site for the City of Windsor, Windsor-Essex region. Happy to be joined by Ramsey D'Souza, who will provide, we've been asked, certainly we've talked on this forum several times around, what is the current situation as it relates to opioids for Windsor-Essex. So Ramsey will provide a presentation on our current statistics and our data and related to the opioid crisis for Windsor-Essex. We have been talking with partners throughout this week just to share information and have open dialogue and discussion around consumption and treatment services. And as you all know, this has been many years that the health unit with our community partners in mental health and substance have been working towards this goal as part of our overall opioid and substance use strategy for Windsor-Essex. So, we're happy to be close to this point in the journey and hopefully get that approval on Monday for this, one piece in our bigger strategy under the Windsor-Essex opioid community substance use strategy. So, without anything further, I'll also acknowledge that we do have Eric Madeline as well, who's one of our directors, who is the lead for this work with us as well. I'll turn it over to Ramsey D'Souza, who will start his presentation.
Thank you, Nicole. Good morning, everyone, and thank you for joining us for this week. As Nicole mentioned, we'll talk about opioids in Windsor-Essex, what has taken place for the past few years, and any comparisons that we've seen since a year into the pandemic and the period before that as well. So let's get started. So looking at our opioid cases in terms of our emergency department visits and overdoses from 2007 up until the end of 2021, we've seen an increase in our overdoses, primarily a big jump since 2017 onwards. And in 2020 and in 2021, since the pandemic took hold in Windsor-Essex, we have noticed an increase as well. But this has been occurring even before the pandemic began in 2020. So when we compare ourselves to the entire province in Ontario, we have noticed both in Ontario and in Windsor-Essex that our numbers and our rates have been increasing, and they're on par with what the other regions in the province are also experiencing. For the period of 2021, we only have available data for our region in Windsor-Essex, and once again, it is showing an increase. But based on the trend for what we're seeing in Ontario, we should expect an increase compared to 2020 as well. When we look at our opioid-related deaths in Windsor-Essex, we saw the highest number of deaths since 2007 reported in 2020, with 64 deaths that took place. Prior to that, in 2019, we saw a much lower number of deaths. And based on what we're seeing in 2021, we should also be expected to surpass in terms of what we saw in 2019. So when we look to break down the deaths for the period prior to a year before the pandemic, from April 2019 to March 2020, compared to April 2020 to March 2021, we saw most of our deaths in both eras were accidental. However, we did see a larger number of accidental deaths in the period post the introduction of COVID-19 into our community. When we look at the pre and post eras as well, we see that a large number in the pre-pandemic era of accidental overdoses took place in indoor private settings. But since the pandemic, from April 2020 to March 2021, we are seeing a distribution of opioid-related death that's taking place in various settings. And this includes hotels, shelters, rooming rooms, and many and in many different areas as well. So when we look at the type of substances involved in both settings, pre and post, we are seeing a large number of deaths that are due to fentanyl. However, since the introduction of COVID and the pandemic onset, the majority of accidental overdose deaths have been due to fentanyl. Just trying to categorize whether these were prescribed opioids or whether they were non-pharmaceuticals in terms of what was found in a person's death for opioids. About 10 percentage points higher, we saw that there in the non-pharmaceutical and post era of the pandemic were due to the non-pharmaceuticals. But however, at the same time, in a small percentage of people, 10%, in the post-pandemic era, we did notice that there were both pharmaceutical and non-pharmaceutical opioids tied to the cause of death. Now, when we looked at our EMS data, and thank you to our EMS partners for sharing this information, between February 1st, 2019 and October 14th, 2021, there were 899, almost 900 suspected opioid and drug-related EMS calls in Windsor-Essex. When we were mapping this out for suspect opioids and drug-related EMS calls by municipality, revealed that the vast majority of calls did come from the city of Windsor, almost 91%. When we look at our eras in pre and post, again, the lighter colors on the left, the yellow and the green, in our pre-era indicates that there were less calls for drug-related situations. Whereas on the right, in the orange and the purple and the red, we have seen an increase. Now, when we look at the number of naloxone kits distributed and at the same time for pre and post COVID-19, we did see a slight decline in the number of naloxone kits that were distributed in our community. Part of that could be due to a number of factors, such as since the onset of the pandemic, access to services at that time frame was also limited, which could have provided a barrier or been a barrier for our residents that required these kits. Lastly, when we looked at the number of opioid-related alerts that we had issued in our community since 2019, we did see a big decline in 2020. However, we have issued about 13 alerts in 2021, which was the highest that we've ever issued. In conclusion, the pandemic in 2019 has worsened the opioid crisis in our region. We have seen an increase in ED visits. Our EMS call and response has also increased, as well as the death attributed to and overdose due to opioids has also increased as well. Thank you.
Thank you, Ramsey. We will move into our media questions now. Do we have any questions from the Windsor Star?
Yes, good morning. And Ramsey, thank you for your presentation. Perhaps Nicole or Dr. Nezathuri, I know you've said these things before, but can you reiterate the effect that you expect a consumption and treatment services site to have, the difference it will make in the region?
Nicole, do you want to start, and perhaps I can supplement your comments?
Yeah. Do you want to start?
Sure. So I think that when we think of, first and foremost, there are more people dying of opioids than car crashes, many times more. Having a safe consumption site is one part of a comprehensive management plan to help reduce the burden of opioid-related illness and death in the community. But it is an important step because it can save the lives of people who are currently using opioids, and also provides them an opportunity to access treatment so that they can get better and ultimately not use opioids at all. So that's the therapeutic goal of having a safe consumption site in the health district.
Yeah, I would just say again, I mean, I'm repeating a little bit, but it is, one part of our comprehensive strategy. And we know several years ago when the WECOS leadership table came together under a 4-pillar strategy, and harm reduction being one of those pillars, that the need for this in the community was identified through that. We have done considerable consultation, and again, it's about meeting people where they're at, ensuring that people are able to use in a safe manner, and also connect them and offer them opportunities, for other care and supports, to a harder to reach population. So, our hope is, we know it will make a significant difference in our community, and we're lucky to learn from the experiences of other communities that have gone before us and that have these sites operating. And so we're taking all of that into account in our plan moving forward.
On a separate issue, the health unit will be moving briefings to 1 a week for media and these video updates starting next week. Can you explain the rationale of pulling back this form of communication when it seems that the pandemic's burden on the region is at its highest it's ever been?
I'll start. I think in our conversation, we're always open to adding additional media briefings. Some of it is the change. We've joined you several times a week, and part of our conversation is around our data and our numbers related to COVID, and just with the change in the management of COVID-19 in the community, and what information we're actually able to share. We just won't have the frequency of information to share that we have had in the past. So that was part of our discussion. And Dr. Nasuri, I don't know if you want to add.
Sure. So one of the key foundations of public health policy and practice is dialogue, communicating with the members of the media, and communicating with our constituents and community members directly. So to the extent that we have every opportunity to do that, we'll continue to do that. And I would say reach out to the team here if we can provide clarity. The one challenge that we now have is with the lack of, at some level, it is more challenging to give an update on the burden of disease to the extent that we don't have the robust testing capacity. Historically, we've been able to report on the number of people who test positive and think of that as a reasonable surrogate of the burden of disease. So we will have to think of other ways of communicating and sharing what we think the current burden of disease is. But if it ultimately becomes more important or valuable to meet more frequently again, we could definitely do that. We always embrace the concept of dialogue.
You sort of alluded to this in what you just said, but has the province yet given any indication of the key metrics the public health units should be looking at now that case counts are unreliable, and what health units should be communicating with the community?
Well, perhaps I could ask Ramsey to comment on that first, and then I can supplement that.
In terms of what the province has communicated, I'm not aware at the moment, but in terms of what we are trying to move towards, we are looking at some sources, including our hospitalizations as well, very closely, our capacity in our health test system. Additionally, we are looking to do more with our wastewater surveillance data as well, ensuring that there's a process for us to be able to share that in a more routine manner with our residents. So there is some work happening internally to ensure that we do work towards that change, and also working towards what some of our definitions mean as well currently with a change in testing capacity.
Yeah, I anticipate that the province will ultimately provide a framework so that we can articulate burden of disease in a consistent manner across the 34 health districts. That would be my hope, and I anticipate that will come to fruition. In the interim, I think that one of the things we have to consider is there are many metrics that one could use as inferential or surrogate metrics for burden of disease. And Ramsey had highlighted them: a number of people in the hospital, the number of people in the ICU, the number of people on a ventilator, the absenteeism rate at institutions, the number of people in self-isolation, the number of outbreaks that can be ascertained, and then data on the actual biological phenomenon to the extent that we can measure wastewater burden or wastewater, the level of COVID in the wastewater. So I think that notwithstanding the challenges with the lack of readily available testing, I think we can still formulate some approach, although it'll be a more complicated approach to communicate to the community.
Thank you.
Any questions from AM 800?
Nicole, just in regards to the safe consumption site, so when the health unit goes to council on Monday, what is the health unit looking for? Is it approval of the site on Goyo, and is it rezoning as well, or what is the health unit looking for?
I don't believe rezoning is necessary. So we did, and Eric can probably correct, but we did certainly reach out to their planning department, et cetera, in regards to that site. So what we're looking for is a letter of support of approval for the site. We need that for the application, like to formally actually apply for the site, both for the province, and we also need it for the application for, for Health Canada for the exemption. So it's the final piece that we need for that application to move forward.
Okay, thank you. And then Ramsey, just going back to some of your, for your presentation, some of the charts. So there was in 2020, there was 3 alerts issued, but then in 2021, was it 13?
That's right.
Okay, and then the number of deaths, you talked about how, I believe you said this, 2021 was similar to 2019. So in 2021, if I looked at that chart right, it was 33, and then 2020, one of the highest at 64. I'm just making sure. My screen's a little small, so I just want to make sure I'm getting those numbers correct.
No, sorry. So in 2021, as of the end of July, we had 33. So if we were to extrapolate that number, we would currently surpass in terms of what we saw in 2019. So even even though our numbers were high in 2019 in terms of the deaths, it would be higher in 2021. So just looking at the time frame pre and post pandemic.
Okay, thank you. And then switching gears. Oh, sorry.
Yeah, if I could just clarify my understanding, and Ramsey can correct me, is there were more deaths related to opioids in 2021. We're projecting more deaths in 2021 than in 2020. The reason that number looks lower is it only accounts for the first 6 months of 2021 and not the entire calendar year. Is that the right understanding, Ramsey?
No. So
Okay.
so 2020 had the highest number of deaths. Based on our current numbers in 2021, the deaths will be slightly lower, but still higher than what we saw in 2019.
Okay. So the deaths in 2021 are projected to be approximately the same as in 2020, but they're substantively greater than in the previous year, 2019. Right. Fair enough. Thank you for that. That helps me understand it a bit better.
So I guess to that point, the chart that was shown, that's only up until July?
End of July, that's right.
Okay, perfect. Switching gears to a COVID-related question. I was talking to an individual that works at our border, and I'm just wondering if a traveler comes back and their PCR test is positive, obviously they're allowed back in the country, but they have to self-isolate. If that individual is not from the Windsor-Essex area, does that count for the Windsor-Essex case counts, or is that, let's say they're from London or the GTA, would that go to their case counts?
Ramsey, do you want to answer that?
Yes, so that would be if their actual address isn't for Windsor-Essex, they would be part of the other jurisdiction.
Okay, thank you. That's all for me.
Any questions from CTV?
Yes, good morning. Yesterday, the province came down with their back to school plan for in-person learning. Have you had a chance to look it over, and what do you think of the measures that they've put in place? Are they enough, and what do you think of the return to school next week?
Look, perhaps I can comment and then Nicole can supplement that. We have continuous dialogue with our colleagues at the school board. I think based on what we know today, I think it's entirely appropriate for schools to open up as soon as possible. And the next, so I think that the opening up schools is a good step. Nothing is 100% safe, but I think that opening up schools can be opened safely with the suite of measures proposed. And I think that we also have to consider the risk versus the benefits. It's particularly important for young people to have the opportunity to go to school. That's particularly important for young people who are in the elementary ages to get the benefit of in-person instruction. I think that it is the right policy, a public health policy decision to reopen schools next week. Nicole, perhaps you could supplement my comments.
The only thing I guess I would respond to is, as far as the guidance goes, Dr. Nasseri is correct. We do meet very regularly every week, sometimes twice a week with our school board partners, and have since before school started. We are reviewing internally, our team, is reviewing that guidance, and we'll update all of our resources and tools. And while our role has slightly changed in the guidance, we'll work with our school board partners and continue to support them, and continue to have those meetings every week to discuss any challenges as schools reopen, and make sure that they can do so in the safest manner possible.
Thank you. And do you have any updates on the vaccine rates for the age 5 to 11 group of children? I believe you gave us those statistics a week or so ago. I'm just wondering if you have any updated stats on that age group.
Always nice to have our manager of epidemiology on, because he is our numbers expert. So maybe I'll ask him to comment.
So in terms of our first dose coverage rates for 5 to 11s, it's currently just under 37%. It's 36.9%. Whereas I believe in the province, it's currently in the low 40% range.
Okay, thank you. And is there an epi summary this week? And if so, what are the takeaways, the main takeaways from it this week?
So in terms of what we're seeing, we are seeing an increase in our hospitalizations. That was the key metric there. Also, when we looked at our wastewater surveillance data as well, we have noticed a huge increase in terms of our viral signal, both speaking towards that COVID is prevalent in our community, even though testing eligibility is limited. So we are seeing widespread prevalence.
Okay, thank you.
Ramsey, could you just share the number of people who are currently admitted to hospital because of COVID?
Currently, as of this morning, there were 95 people hospitalized for COVID, and 14 of them are in the ICU.
Right, and that's in a health system of approximately 600 people, is that right? 600 hospital beds?
Approximately, that's right.
Yeah, so just continuing as a burden of disease, about 15% of all the hospital beds in Windsor-Essex are occupied by people who have COVID-19. And so that's an important surrogate metric of burden of disease.
Thank you. Any questions from CBC?
Yes, thank you for those facts about the hospitalizations. I wanted to ask about that today. 95 people, that's a significant jump over the last 2 days from, I think on Tuesday, we reported 67 people hospitalized. How is the hospitalization system locally handling that number of patients, and have we had to transfer anyone outside of the region?
If I could just comment, you know, the first thing I would share, and this is in my experience as a hospital doctor, 95 people out of 600 is a significant burden of disease or significant service demand for a hospital. And stated another way, if that number was 0, there would be 95 beds to manage people who perhaps have scheduled care or would or other procedures or services that they might need to effectuate their health. So that's sort of a hidden or an unrecognized burden of COVID-19 is that people who need services other than COVID are not receiving that. And in fact, hospitals have scaled back elective or scheduled surgical procedures and surgical treatment. The level of transfer out of the institution, that's a question that's most appropriately answered by the hospital. I would ask the CEO of both hospital groups to perhaps, if you were to communicate with them, they could sort of comment on what is the level of transfer. It is a perfectly appropriate surrogate measure of burden of disease to understand what percentage of patients require transfer to manage their illness. But we don't have, to my knowledge, the Public Health Service doesn't collect that data, and it would not be the most robust as opposed to getting it from hospital partners.
Okay, thank you. And just back to the school situation, Ramsey, I was wondering, do you have updated numbers on the infection rate amongst those 5 to 11-year-olds, keeping in mind that data is a bit inaccurate now with the changes to testing?
Not at the moment, just because of the variability and of that, the number is inconsistent to be meaningful at this point.
Thank you very much.
Any questions from Blackburn? We will come back to Blackburn at the end. We have a follow-up question from Windsor Star.
No, thank you.
I'm back.
Okay, perfect. Go ahead.
Sorry, I was muted. I do have one question about the safe consumption site, and we know that these sites continue to be controversial in communities. What would you say to the community to kind of allay their concerns about hosting a site like this?
Maybe I'll start. You know, I see Eric's popped on, and so I'm sure he may add as well. He's been championing this effort within our team for quite some time, but I'll maybe just start to say that we have a very, you know, we've had a very thorough process in reviewing and moving towards this point. Some of certainly we've had our police partners involved along the way. You know, everyone taking their role. There's certainly around the broader community and those safety and security concerns that I think those are some of the items that usually are flagged by broader community partners, as well as, you know, many members of our, you know, mental health and addictions, you know, leadership have been part of this process along the way. In the consultation process, you know, we took great strides and effort to make sure that we provided town halls and talked to residents and businesses in the surrounding area to listen to their concerns. And, you know, all of that feedback we will be taking into the actual, you know, site itself as well. You know, there are certain, and Eric can add to it, there are certain things that are required as part of the application. So, you know, we're not the first to do this. Many of these sites exist, and you know, so there are certain standards and requirements and things that are needed to be done and also reported on regularly as well. I would just say that our plan, of course, is to continue to have an advisory, certainly once the site is like, you know, once we're building the site, and then once it's established, to have that ongoing dialogue with the stakeholders as well as community members surrounding to make sure that we're, making sure that the site is adapting to the needs of the individuals that are using it, but also that we're addressing any, real, concerns and mitigating those along the way. And maybe Eric can summarize it in a much cleaner way than I have, but.
No, that was a pretty good assessment there, Nicole. But the only thing I'll add is, just I guess reiterate that community engagement's been a central pillar of the process to moving to where we're headed on Monday. You can, residents of our community, if they're concerned or they want to know more about that process, the council agenda package is posted on the City of Windsor Council website. All of our reports, all of the information, I would encourage members of our community to review that. That information details our consultation process, our engagements with members of the business community. You'll hear from members of our community residents associations on Monday at the council meeting as well. There are a number of letters of support included within that council agenda package. Reviewing those would be a good measure, and you'll see that what's been articulated throughout this process by our community is that there's an acknowledgement of the very real issue in the downtown core, and that regardless of whether it's a supervised consumption site or a consumption treatment service site is established there, consumption is occurring in the community in that area. So what this site proposes to offer is not only supervised consumption to prevent preventable death and illness caused by consumption practices, but also an avenue for people to get support on not only addictions and treatment services, but also other social services like housing or food support. So this really is we would propose that this really is an all-encompassing site that should be, as Dr. Necessary mentioned, this is one piece of the bigger addictions treatment harm reduction landscape, but is something that is very much needed in our downtown community.
One thing that needs to be, I think, included within this all-encompassing effort is a shift in attitude within the public from thinking of addiction issues as crime to more of a medical issue. Do you think that shift is taking place?
What we heard from the community. Oh, I'm sorry.
Go ahead, Eric. No, you're a wonderful resource on this topic. So please go ahead.
Thank you. What we heard from the community throughout our consultation is indicative of a shift in perspective, and a lot of the great work that's been done by a number of our community partners, including Positive Pathways Community Services, the former AIDS Committee of Windsor, who spearheaded the Label Me Person campaign, which is an anti-stigma effort for people who use substances, recognizing that addiction and substance dependence is an illness, and that there needs to be a lens applied to working with these folks that is reflective of that, and provides them with not only treatment for when they're ready, provides them with treatment for their substance dependence, but also provides them access to other services that they may not have accessed without the types of interactions that we're proposing at a CTS site.
Thank you very much.
Yeah, if I could share, I think it's well settled in medicine that substance use is a medical condition and should be treated like all other medical conditions. There's an overlap between substance use and other psychiatric and mental health issues, and those two need to be treated. So if one has both diagnoses, both conditions, they both need to be treated appropriately to have an optimal clinical outcome. The second item is that it's not that people are using substances throughout the community. They're using them at home, they're using them at the office, they're using them at the park, they're using them perhaps in the car. And we have to accept that reality that people are currently using substances throughout the community at various sites of service. Some of them are hidden, some of them are more acknowledged. Thirdly, I think it's worth understanding that it is entirely. I understand why people are reluctant to affirmatively support the location of a safe consumption site. But I think that the key thing is that supporting one is part of the compassionate, our obligations as citizens to be compassionate towards others. And just like none of us would oppose a hospital being built close to our home. We should understand that the services provided to people who are currently using opioids and other substances warrant the compassion that we would give other people that are sick. And that sometimes means one has to suspend their opposition to it to recognize that it serves something more important to the community than just one's individual preferences. So I know I've spoken boldly on this, but it is really important for the community, the people of Windsor-Essex, to get the approval this upcoming week to move forward with the safe consumption site.
Thank you very much for that.
Any follow-up questions from AM 800?
I have one for Ramsey and one for Eric. Just a quick one for Ramsey. Ramsey, just in regards to the number of overdoses in 2021, 416, and is that for the entire year? That's up to July as well. Just looking for.
No, that's for the entire year.
Okay, perfect. And then one for Eric. Eric, so if council approves the location Monday night, what are the next steps? Could this be up and running by the end of this year? I know it all depends on the upper levels of government, but and I'm not sure if you can get into this, but I know there's obviously a landlord of that property. Is that already worked out, like a deal, an agreement's already worked out there? And then once the government approves it, this site can be up and running?
My apology. There's a number of steps that need to be taken beyond, the council meeting on Monday. Should we receive the endorsement of City Council, the next step would be to, integrate the final components into the application process, and that's something we would endeavor to finalize quickly. There are two separate applications. One is to Health Canada for an exemption to the Controlled Drugs and Substances Act, and the other is to the provincial government for the actual operations of the site. So both of those applications require some form of council endorsement that, if we're successful on Monday, that would be sufficient to meet that need. And then we would move forward with completing the application, submitting them, and then that it'll be in the hands, as you mentioned, of the upper levels of government to provide us with those approvals. If they have additional questions on our application, there could be a little bit of back and forth. If they require additional resources or materials, there could be a little bit of back and forth on that as well. But certainly we would endeavor to get this application into their hands as quickly as possible after Monday, should we be successful.
Thank you. Have a good weekend. Sorry, Nicole.
I was just going to say, I mean, we would be hopeful that we could be up and running by the end of the year, but don't want to predict the future. But I think, that was always the timeline that we were working on once we applied, that we could move quickly. And I'll just comment on, we do have sort of a temporary agreement with the landlord and would move to a more fulsome agreement once we have that approval. So, I think we've said before, we feel we're in really good shape. It's just getting it in, and then we're at, we're at the mercy of the waiting game and how quickly those approvals go. But, we want this to move as quickly as possible. And so we are very hopeful that, by the end of the year, we would be able to achieve that goal if we get that approval on Monday.
Thank you. Have a good weekend.
Any follow-up questions from CTV?
Yes, just one question. The Canada Border Services Agency says some truckers will be exempt from a vaccine mandate taking effect this weekend. Although this is a federal decision, do you have any concerns locally about the thoughts of unvaccinated truckers crossing back into our region?
Well, we defer to the federal authorities on the management of the border, and they're the best people to comment on that. As a general construct, we encourage all people to get vaccinated. We know that individuals who are vaccinated are less likely to get COVID. If they do get COVID, they're less likely to get seriously ill from COVID and die from it. And on a population health level, the higher the percentage of people that are vaccinated, the lower the burden of disease to the community. It's worth noting that the number of people who present to the hospital is a function of the number of people who are currently infected. The more people that are vaccinated, there are less people that are infected, there are less people that are sick, there are less people that will present to the hospital. So as a general construct, we encourage all people to get vaccinated who are eligible for vaccine.
Okay, thank you.
Any follow-up questions from CBC?
No, thank you.
And any follow-up questions from Blackburn?
Nope. Have a wonderful weekend.
All right. Thank you all for joining us today. Our next scheduled meeting will be Thursday, January the 20th. Have a wonderful day.
Thank you, everyone.